You're ready.
Hello. Since it's football season, I apologize, but I'm going to be making an analogy. We've now entered the fourth quarter, and it's still a tie ball game, but our offense is looking pretty good, and our defense is looking pretty good. There's a little time left. The stakes are getting higher and higher, and we just can't fumble the football at all. I wanted to talk to you a little bit about the process that we're in right now and some key points of intervention. You know, the Senate Finance Committee is debating this bill. There's no public option in it. Some people are feeling disillusioned. Some people are feeling depressed. I want to make it very clear to you, don't be depressed. Don't feel that the game is over at all. It's far from over. In the House of Representatives, 3 committees have passed legislation that included the public option. And right now they're merging the bill into one. And we're feeling fairly confident that that bill that's going to come out of the House of Representatives will have a public option in it. In the Senate, it's unclear that the Senate Finance Committee is going to pass a bill that will have a public option in it. The likelihood that it won't, but there will be more senators voting for the public option in the Senate Finance Committee today than what we thought who were going to be voting for it a month ago and 2 months ago. That bill in the Senate Finance Committee is going to be merged with the bill that came out of the Senate Health and Labor Committee that does have a public option in it. And we're going to be urging people to call Senator Durbin to make sure when those 2 bills are merged that the public option is in that final Senate bill. It may or may not be in it. And if it's not in it, don't give up. There's another point of intervention that happens. That bill that comes out of the Senate that may or may not have the public option in it will pass, but it's going to be a different bill that's what's in the House. And both those bills are going to come together, what's called a conference committee report. That's another key point of intervention, that at that point, we must have the public option in it. And we must make sure that Senator Durbin, who has stated that he supports the public option, is taking a leadership role and make sure that that public option component is in that conference committee report. And what we've been told that we may be facing that sometime in late October. The other key thing I want to talk about is the public option. Not only does it give us choice, that we can keep our private plan or be able to choose a new private plan or to be able to afford and get access to a public plan. It's really important that we as Americans should decide on our behalf what plan that we want. 2, it's going to control costs, not only for those people who are in a public plan, but for those people who are in a private plan too. Without it, the insurance industry's costs are going to continue to skyrocket. And lastly, it's going to bring accountability. We live in a system of checks and balances. We've got the president, the executive branch, the legislative branch, and the judiciary branch. We need to be able to have a check and balance in the insurance industry, to be able to hold them accountable and to hold them honest. Lastly, it's also going to increase access for many people who just won't be able to afford private health insurance. Urging people to call your congressman, make sure that they support the public option. Call Senator Durbin to make sure that he uses his political influence in the Senate to make sure that public option is alive and well. And lastly, we're asking people to get your organization to sign up for and show your support for the public option. There's going to be a sign-up sheet on our website. Whether you belong to an individual congregation, or you belong to a local union, or you belong to a senior center, get your organization sign up. Take action. We've got this victory within our grasp. We got to keep on fighting.